Hi, a very good evening. Welcome to our dinner session. So, in today's live session, we'll go ahead with MCQs discussion as planned. So, I'm ready with my presentation. I hope you guys are also ready. So, before we start, so those who are joining today's live for the first time, please keep the following three factors in mind. The first and foremost thing, whatever topic or point or question which you come across, consider that very, very important. Imagine that it's going to be repeated in the final exam because that kind of orientation gives you the sense of seriousness and you will not take things for granted. Number one. Number two, make notes, actively participate. And number three, try to enjoy the process because learning itself is fun. Learning as such is fun unless it is imposed. If it is imposed, if it is made a rule, right? Like you have to attend this class, attendance will be taken, or else you'll be punished. If it is imposed in one way or other, it wouldn't be enjoyable. Unfortunately, that's how we were conditioned to right from the beginning, right from very early age. But learning per se is fun, isn't it? So let's see what we're going to learn today. And also you can present your scores at the end of the session. So we have 5 questions, maximum of 20 marks. So let's see how it goes. So I hope the streaming is all fine. Yeah, once again, a very good evening, everyone. So if you have any issues with streaming or audio quality, or if you want me to raise my voice, do let me know. So first of all, as I said, the pattern of these sessions is we've taken a poll before we planned these live sessions, and majority of you asked for MCQs. So we're combining MCQs along with key topics, along with literature reviews. If you observe, between each question, I'm giving you some additional information. So consider making notes very important, and you can have an exclusive notes for all these live sessions. And we're going to have several live sessions coming up. Also, those are planning to give the upcoming entrance, we have crash course. And also for regular batch students, NEET MDS 2023, we have regular batch which we launched in the month of October. So you can get back through mail or check our website for more details. And before I go ahead with a first multiple choice question, so this is something which I wanted to highlight. See, 5 a.m. clubs. We restarted our 5 a.m. clubs again. So previously we had 5 a.m. clubs. We had 21-day challenge. We had 7 a.m. 7-day challenge, and then we conducted 5 a.m. clubs for 1 week before week. And then this week we restarted our 5 a.m. club where we are discussing a very interesting topics related to human psychology, related to subconscious mind, about our brain's potential, and so on and so forth. There are so many interesting things that are happening. And the reason I'm insisting on this is in order to wake up early in the morning, one should have a driving force. I mean, if there is no driving force, why should we wake up at all? Why can't we just extend our sleep? So one should always have a driving force. And as I said, you can consider these live sessions as a form of driving force. If not, you can plan your own activities. Waking up early in the morning, as I said, even if you mathematically calculate, you'll get a minimum of 3 to 4 hours of qualitative time per day, not per week, but per day. So just imagine in a week's time, you can make an additional 24 hours of quality time exclusively for your preparation, or it can be any of your priorities based on your priority list, as I mentioned in one of the previous live sessions. Waking up early in the morning also has another advantage, that is, in order to wake up early in the morning, one has to sleep early, relatively early, which means the time which goes for smartphone browsing, usually late nights, or watching various shows or programs on OTTs, it gets minimized or cut down. So that's another added advantage you have. So overall, you will have more of qualitative time for yourself, for your own priorities, to meet your own challenges. So that's the reason I'm insisting on this 5 a.m. club. So if not till the date of your exam, we'll continue having these 5 a.m. clubs as much as possible, and we'll try to get habituated to waking up early in the morning. And also, research clearly demonstrates that a minimum of 21 days or 3 weeks is required to form a new habit, to build a new habit, to cultivate a new habit, We tried the same in our 21-day challenge, and many of us succeeded. And in fact, many of you mailed saying that we started waking up early even without an alarm. It's all possible. It's all practically possible, right? So with these introductory comments, let's go ahead with our first multiple choice question. I hope you guys are all ready, right? So here you go. Effects of fluoride on tooth structure include all of the following except increased crystal size, rounded cusps, both of the above, none of the above. So which one do you think is more appropriate answer? Please go through the question once again carefully. Effects of fluoride on tooth structure includes all except. So which one do you think is more appropriate answer? As you know, fluoride plays a very crucial role in preventing dental caries. We use it in various means possible. And this fluoride has pre-eruptive effects and post-eruptive effects, as you're all familiar with. So there are certain pre-eruptive effects which impact the structure of tooth as such, and it's been proven scientifically. And post-eruptive effects, as you know, fluoride inhibits enolase enzyme, destroys or eliminates karyogenic bacteria, and also it promotes remineralization, decreases the tendency to demineralize, and there are so many added benefits of fluoride. That's the reason why fluoridation, water fluoridation, milk fluoridation, salt fluoridation, we come across these topics in perio as well as in public health dentistry, and these have been one of the most successful programs worldwide, especially water fluoridation. If you remember, in preventing dental caries and preventing a disease altogether, which is very much possible. So, which one do you think is more appropriate answer? So, effects of fluoride on tooth structure include all of the following except. So, I suggest you to revisit your key once again. So, in the meantime, let me review some literature. Yeah. Okay. But don't get demotivated, even if you're wrong. We'll improve, don't worry. So the concentration of fluoride in enamel increases with fluoride content of water supply and increases towards the surface of enamel. And there are some pre-eruptive effects. So enamel formed in presence of fluoride has improved crystallinity, increased crystal size, therefore decreased acid solubility. And also the cusps are more rounded and the fissure pattern is more of shallow, right? So this effect is considered to be minimal, but there is some effect. So these are some of the pre-eruptive effects. That's the reason why I told you, please read the question carefully, because it contains the keyword except, right? Negative connotation. So post-eruptive effects include, so newly erupted teeth derive the most benefit, especially with fluoride exposure, systemic fluoride exposure. So fluoride inhibits remineralization, promotes remineralization of early caries, also enhances the degree and speed of remineralization, and renders remineralized enamel more resistant to further attack, fluoropatite formation, you know the whole story. It also decreases acid production in plaque by inhibiting glycolysis in karyogenic bacteria, as we discussed prior. And also an increased concentration of fluoride in plaque inhibits synthesis of extracellular polysaccharide. And it has been suggested that fluoride affects pellicle and plaque formation. So these are some of the benefits associated with fluoride, either in blood, either in tissue fluid, or in gingival clavicular fluid, or in saliva, right? Fluoride as a whole. So as majority of you rightly chosen, I'm glad you revisited uh, the key and you updated your answer. Well done. Option D is right answer. So if there is no except, option C is right, as majority of you pointed out. So whenever you answer an equation, before you choose the option, make sure that you're going through the entire question and all the options, not once, but at least twice. Even if you're damn sure that this is the right answer, just go through the entire question, all the explanations at least twice. Consider that as a self-imposed mandatory rule. Okay, so well done. So those have answered it as option D, award yourself +4, regardless of what you answered previously. Well done. Now let's move on to the next question. I hope the image is clear. So identify the instrument. Is it straight probe, neighbor's probe, DZ16 Explorer, WHO probe. So which one do you think is more appropriate answer? Yeah, I think the image is pretty clear, right? I try to maximize it as much as possible. So identify this hand instrument. It seems to be a hand instrument, stainless steel. You have, it's obviously double-ended. You have the shank, you have the working portion, and then you have the handle. The working portion seems to be very thin and very sharp and very long. So what could this instrument be? Is it straight probe, neighbor's probe, TG16 Explorer, or WHO probe? So which one do you think is more appropriate answer? And those who answer, or those who have chosen a particular option, you should explain why, isn't it? Okay, because when you attend any MCQ test, you want an explanation. So I want an explanation from your side as to why you think it is a particular option. So as majority of you rightly mentioned, excellent. DG16 is right answer. Very good. So what does DG stand for? In fact, this has been an elusive question for us during our post graduation. We were constantly asked by our staff, like, what is DG16? What does DG stand for? What does 16 stand for? Unfortunately, we couldn't find out unless and until we were in final year, where our first year juniors attended a conference, and one of the gentlemen over there was kind enough to give the answer. So, anyways, we found some literature currently, and I'm not going to quote what that gentleman said, but I'm going to quote directly from literature. So, what does DG stand for? Very good, Sanjay. Yeah, it's used to locate canal orifices, remove tiny calcifications, open up tiny canal orifices as well. So, canal identification and location. Very good. So, what does DG stand for? So it was introduced. It's an endodontic explorer. So by now it must be clear for you. It's an endodontic explorer which is introduced by a particular person by name DG. We'll expand it. You can try to find out. In 1951, the instrument is designed, yeah, because you cannot either use a straight probe or an explorer to locate canal orifices, especially in posterior teeth or even in anterior teeth, because it's difficult to angulate. So you have this specially designed endodontic explorer, DG16. Very good, Monica. I'm glad you know. At a level of UG itself, you're able to answer this. Even during a post graduation, we never knew it. As I said, it was an elusive question. We never knew the answer till we reached our final year. Yeah, you're right. Dr. David Green in 1951 introduced this. So there were three forms. DZ16, 16 is the length of the working portion, that is 16 mm. So you have three forms of these instruments: DZ16, DZ16 by 17, and DZ16 by 23. So it has a long tip with a sharp point. It's a very sharp point because you need to locate the canal orifice. The tip length is 16 mm. Yes, it was stainless steel. Very good. So as majority of you have rightly chosen, option C is right answer. So please award yourself +4. Now moving on to the third question. So let's see. Painless symmetry, painless facial symmetry, diplopia, enophthalmos are features of. So which one do you think is a more appropriate answer? I'm sorry, it is supposed to be asymmetry, right? You'll find asymmetry because of enophthalmos. So I think I can edit it now itself. Oh, yeah, please go ahead. So painless facial asymmetry, diplopia, and enophthalmos are features of which of the following syndromes? Sika syndrome, silent sinus syndrome, Sjogren syndrome, Stickler syndrome. So Sika syndrome and Sjogren syndrome, dry mouth, dry eyes, and also you have this rheumatoid arthritis, autoimmune like symptoms in case of Sjogren syndrome, but no symptomology in case of Sika syndrome. That's a chief differentiating feature. Let's keep them aside. Stickler syndrome is something which is associated with cleft palate. We'll look into the details in brief very shortly. What about silent sinus syndrome? What is the silent sinus syndrome? I reckon some of you might be hearing it for the first time. Does it mean the sinus is silent without making any sounds and it is associated with various clinical features? So, what's this all about? So, try answering this question. In the meantime, let's review each of the options. So, first and foremost, Sika syndrome, as I said, dry eyes and dry mouth, xerostomia and keratoconjunctivitis Sika. So, there is an increased risk of developing parotid lymphoma with this condition. Interestingly, all the Sika syndrome has certain serological abnormalities in common with systemic connective tissue disorders like rheumatoid arthritis. It doesn't have any of the symptomology, unlike Sjogren's syndrome. Please make a note of this point. So this is how you differentiate Sika syndrome from Sjogren's syndrome. So Sika syndrome is also called as primary Sjogren's syndrome. The Sjogren's syndrome per se is secondary Sjogren's syndrome. So in addition to dry eyes and dry mouth, that is seen in Sika syndrome. In case of Sjogren's syndrome, that is option C, you'll also have serology and symptomology of an autoimmune condition, such as usually rheumatoid arthritis, but even systemic sclerosis, primary biliary cirrhosis, etc. There can be actual swelling of salivary glands, which is relatively uncommon, and late onset swelling of parotid may herald the presence of a lymphoma. So these are some of the features of Sjogren's syndrome. Stickler syndrome, its commonest syndrome associated with cleft palate, consists of flat midface, cleft palate, myopia, retinal detachment, hearing loss, and arthropathy. Stickler syndrome. Silent sinus syndrome, as the name itself indicates, it is associated, according to some reference articles, it is associated with asymptomatic chronic maxillary sinusitis, right? Maybe that's the reason why it's termed silent sinus syndrome. So, in fact, there is collapse of maxillary sinus because of negative pressure due to lack of ventilation at osteomeatal orifice. So which has to be surgically open. We'll get back into the details again. So because of this collapse of maxillary sinus, even the orbital floor is collapsed because it's part and parcel of maxillary sinus, if you remember, due to which there is anaphthalamus, diplopia, and facial asymmetry, right? So silent sinus syndrome can cause painless facial asymmetry, diplopia, and anaphthalamus. It is spontaneous collapse of maxillary sinus and hence orbital floor, which is its roof, associated with negative sinus pressure, presumed due to failure of ventilation at osteomeatal complex, which needs to be surgically opened. So that's the literature behind this. So painless facial symmetry, diplopia, and anaphthalamus, as majority of you, I think almost everyone, yeah, as majority of you rightly mentioned, option B is right answer. Well done, everyone. Keep it up. So as you can see, anaphthalamus in this particular case, which gives that slight asymmetry. Okay. Yeah. Now let's move on to the penultimate question. In which of the following locations would one most likely find yellow bone marrow? So very basic question, plus one, plus two, standard question. Let's see how many of you are going to get it right. Even if you get it wrong, it's absolutely fine. The reason why I said it's plus one, plus two, not to undermine this question, but to remind you the fact that we already had gone through this particular topic in plus one and plus two. Okay, right. So in which of the following locations would one most likely find yellow bone marrow? So is it head of long bones, or is it center of long bones, or is it cranial bones, or is it all of the above? So which one do you think is more appropriate answer? So first of all, yellow bone marrow, primary function, fat deposition. So there is no erythropoiesis, hematopoiesis associated with this. So where do you find it? Yeah. Is it a tricky question? Let's see. So let's review some literature regarding yellow bone marrow and location. First of all, whenever we look into Tom and Jerry or any cartoon, we have this misconception that bones are solid structures. They are like rods, metal rods. In fact, Toffee and Tiger also they eat bones every day, but they are solid structures. In fact, they are not bones, calcium biscuits. So my point is, bones are not solid structures. The inner aspect we find a cavity. It's hollow. It can be any bone for that matter, which contains bone marrow, as you know, yellow bone marrow, red bone marrow. So let's review some literature. So yellow bone marrow functions primarily as a site for fat storage and is found in center of long bones. Yeah, as majority of you rightly said. center of long bones is right answer. So you can observe the illustration simultaneously and we'll review some additional literature. So the bones are not solid structures. Cavities in cranial bones, vertebrae, ribs, sternum, and ends of long bones contain red bone marrow. So this red bone marrow is responsible for formation of erythrocytes, platelets, leukocytes, thrombocytes through a process called hemopoiesis. So yeah, before birth, these formed elements, right? They are formed apart from the mentioned structures. Liver, spleen, lymph nodes also contribute to these formed elements, right? And also, you know about red bone marrow, about various precursor cells, stem cells, and all. Let's not go in depth. However, when a child is 7 years of age, yellow bone marrow begins to appear in distal bones of limbs. This is something which is very important. Do make a note of it. So, when a child is around 7 years of age, yellow marrow begins to appear in distal bones of limbs. This replacement of marrow gradually moves proximally so that by the time the person becomes an adult, red bone marrow is restricted to bones of skull, the vertebral column, the thoracic cage, the girdle bones, and the head of humerus and femur, right? The reverse. So this is the location of red bone marrow. So make sure that you're familiar with these anatomic locations and consider them very, very important. As majority of you rightly said, yeah, it is center of long bones. Yeah, no age mentioned. Yes, that's a technical point, but in general, yes. Whenever any question is asked without mentioning age, just assume that it's in case of adults, a normal adult. Whenever we talk about weight, whenever we talk about blood pressure, whenever we talk about height, we talk in terms of normal adult age, right? So that's by default. If not, the specific age will be mentioned, either young age or old age, or else consider that question to be that of related to adult. Okay. Now let's move on to the final question, penultimate question, case based again. Let's see how many of you are going to get it right. So it's about a clumsy dentist, the story of a clumsy dentist. So clumsy dentist, while doing root canal, accidentally drops a file in patient's mouth. The patient aspirates the file. A chest X-ray will most likely reveal the file being lodged in which are the following options? Trachea, pulmonary artery, left primary bronchus, right primary bronchus. Which one do you think is more appropriate answer? The reason why I mention it as clumsy dentist, or you can use any negative word you want to, because whenever you perform any clinical procedure, isolation is prerequisite. It's not even mandatory, it's prerequisite, right? It's part and parcel of procedure. And whenever you're going for crown placement, trims, or root canal treatments, majority of dentists, at least based on my experience, based on my visual experience, never use rubber dam, even postgraduates for that matter, which is very unfortunate. So all of them can be termed as clumsy dentists, right? So something there shouldn't be any compromise. Would you do the same to your own family members, to your mother, to your father? You wouldn't do that, right? So what difference is there? So clumsy dentist, while doing root canal, accidentally drops a file and further complicating it, the patient aspirates the file. It's not the mistake of the patient, though. The chest X-ray will most likely reveal that the file is lodged in which of the following options. This is a standard question. You might have come across this question n number of times. Also, this was asked in various previous entrances for your information. So, why? What are we trying to discuss here? So, we're trying to understand the anatomy of the bronchus in specific. So let's look into lung. So as majority of your rightly said, option D is right answer. Well done. Do award yourself +4. So as you can see, this is a chest X-ray of a lung. So you can clearly see the dark spaces. So the lungs basically are cone shaped, right? You have the rounded apex, and then you have concave base facing the diaphragm, and then you have convex costal surface, and then you have concave mediastinal surface, and in the middle of mediastinal surface, in this area, around this area, you find root of the lung, which is represented by pulmonary artery, pulmonary vein, nerves, and primary bronchus. So this is where you'll find the root of the lung. So the reason why we're trying to discuss this is when compared to left primary bronchus, the right primary bronchus is larger, straighter, and more vertical. So that's the reason why, if at all there is any aspiration, there is a greater chance for the foreign object to be lodged into right primary bronchus. And as you guys have rightly mentioned, right primary bronchus is the right answer. The chest X-ray will most likely reveal the file lodged in right primary bronchus because of the anatomy, because of the orientation of this primary bronchus. I hope it's clear. So please award yourself +4 and do present your scores now. So how much did you score this session upon 20? Very good. Yeah. So this is what I wanted to highlight in this current live session. So you have any queries, you need any further clarifications, always feel free to get back through mail 24/7. So I hope you guys are all doing good. And regardless of challenges you're facing, and no matter what the situations are that you are in currently, always believe in yourself, right? Because if not you, then who else is going to? So just believe in yourself, keep giving your best, work hard, work consistently, and most importantly, as I keep on reminding, no matter what, just believe in yourself and keep giving your best. Also, we started doing YouTube shorts exclusively for YouTube subscribers, and today we launched our first YouTube short dedicated to preparation. So preparation tips will be coming up with more shorts, more tips. Right? It's a 60-second video, and today we made a video on scheduling the day. So do check it out and try it out and provide your feedback. You're more than welcome. And I hope the shorts will be helpful for you, especially during this revision phase, right? And I'll see you again tomorrow in 5 a.m. club. I know it's a challenge. It's not easy because resisting temptation, sleeping early, and having the driving force to wake up early, it's no easy task. But if you have the driving force, right, success is all yours, no matter what the task is. So have the driving force, take up this 5 a.m. club as a challenge, and just tell yourself, I'm going to wake up early in the morning and attend this 5 a.m. club no matter what. So try it out. And as I said, in a matter of few days, in a matter of few weeks, you'll be habituated to waking up early in the morning and you'll start enjoying your day as such. Keep aside preparation, keep aside other challenges, but you'll feel more energetic, more positive, and your perspective will be even broadened. Take my word, right? So with this, let me conclude our live session. And as I keep on repeating in every session, if you have any queries, you need any further assistance, always feel free to get back through mail at 24/7, right? Yeah. Good to see your scores, Dr. Nidhi, Divyansh, Sanjay, Priyanka, Smriti, Sujay, Avani, Swadina, Vinita, Kritika. Very good. So I think majority of you have scored 20 upon 20. Danish, yeah. Well done. Well done, everyone. Let's keep this enthusiasm and momentum going. I wish you all the best. Love you all. Have a pleasant sleep. Just sleep like a baby. Take care.